Today I'm going to show you how to make a blood smear using the manual wedge technique. First, we're going to go over the supplies that you'll need in order to make a blood smear. To start off with, you're going to need a properly collected specimen like this one. You're going to need whole blood that is collected in a tube that is an EDTA tube, which would be a pink top or a lavender top tube. Here we have the pink top. You can also use other blood specimens, such as blood from a heel stick or blood from a finger stick. But those have their disadvantages because you would have to make the smear right when there's a draw. The EDTA tube is preferred because you don't have to make the smear immediately, and it generally prevents platelet clumping so that your platelet estimate will not be off. You're also going to need a 3x1 inch slide. Actually, you'll need two. One will be the slide that your actual blood smear will be on, and the other is going to be your spreader slide. You're also going to need a way to get the drop of blood onto the slide. You could use wooden applicator sticks like these, which you would need two of to get the blood onto the slide, or some laboratories provide toppers that are blood dispensing toppers like this, and they put one drop from the top of here straight from the tube onto the slide. After you have gathered all of your supplies, you're going to want to place a 3 milliliter drop of anticoagulated or unclumped blood at the edge of your slide. I will demonstrate this using both the wooden stick applicators and the blood dispensing topper. You're going to make sure that your blood is still well mixed. Take the top off. Take your two applicator sticks. Put them into the blood. And you're just going to kind of dot the edge of your slide. About that much blood. It should look about like that. If you do have the blood dispensing toppers, you're going to place it at the top of your tube. You're going to take it and firmly press it on the edge of your slide where you want the blood drop, and it's going to make a nice drop of blood right there. So it rolls off a little. So too large of a drop is going to create a long or too thick of a smear like this one, and too small of a drop is going to create a short or a thin smear like this one. Okay, so once we have the drop of blood on the smear, you will hold the spreader slide at a 30 to 45 degree angle and bring it back to the drop of blood. You're going to wait for the blood to flow across the edge of the spreader slide, and then you'll smoothly, in one fluid motion, push the blood forward to the end of the smear. I'll demonstrate this now. You drop the blood. You're going to hold your spreader slide at the 30 to 45 degree angle. You're going to have it come across the edge of your slide, and then you're going to smoothly push forward. This is an example of a properly made blood smear. All smears should follow the following guidelines. You're going to want the smear to cover 2/3 to 3/4 of the slide, like this one. It will have a slightly rounded edge, and the lateral edges on each side here will be visible, but should not be too narrow. You can barely see, but the edges are visible on this slide on the top and bottom portion. And the slide should be smooth without irregularities, holes, or streaks. And when the slide is held up to the light, the feathered edge over here is going to have a rainbow appearance. It should also not have the whole drop of blood picked up. Here, the whole drop of blood was picked up by the spreader slide, and you don't have any after effect. Here are some examples of improperly made slides. On this one, this slide is way too far away from the edges, on the lateral edges here. This slide overlaps the edge and doesn't give a lateral edge. The blood literally came off on the slide. And then up here, it's irregularly shaped. This one is going to have an example of some clumping, making it irregular right here in the middle. Too much blood was used on this slide, and upon drying, holes were visible in the slide. This slide was not, when the spreader was taken back, it did not go all the way across the spreader slide and was made too quickly, making it way too narrow. The edge is also poorly done. And this is an example of a slide where the whole drop of blood was not picked up. You can see part of the drop of blood back here, and then the rest of the part of blood was spread across. That concludes my demonstration portion of making a manual wedge smear. I will now be talking about applications of use for the blood smear in the clinical setting.